Okay, so to start, you're going to check your patient's chart for any indications of an NG tube, and then you're going to go over, put on your PPE if needed, and make sure you do some hand hygiene. And once you've done that, identify your patient, typically with a name tag, with a date of birth, and of course their name. Then you're going to let them know what we're doing today, the purpose of the NG tube, essentially why they're getting it, any complications that can arise, discomforts, and let them know any interventions that you can make, such as topical sprays. Alright, so then you're going to make sure your curtains are drawn, the door shut, patient's comfortable. Make sure they're in a Fowler's position, 45 degrees. We've already done that, and the railing's down. So essentially, now that they're comfortable, we can move on to getting the NG tube. So, we're going to put this pad down. And we're also going to put an emesis base in there for them as well. And some tissues for if they experience any discomfort. Alright. Moving on now, we're going to measure. So in order to do this, it's the tip of the nose to their earlobe, and then all the way down to the xiphoid process. And here it's already been marked, so I'll go ahead and leave it, but we would typically mark it. Now before we insert it, we're going to put on some gloves. And not put it on the patient's head. And it also helps to ask the patient which nostril they breathe stronger out of. Depending on which one that is, that's the one we'll use. So, we're going to go ahead and lubricate the tip. It's about 2 to 4 inches that we're going to want to lubricate. Alright, and then we're going to want to make sure our patient leans their head back while we do this. So I'm going to start doing like such. Now I'm going to assume it's about in the pharynx now. So I'm going to ask the patient to move their head forward. And if I had an assistant, just to demonstrate, they would give the patient the thing, and they can go ahead and drink while that's happening. So we can assume they're drinking while that's happening. And I'm going to keep pushing the NG tube back. If you encounter resistance, typically you just kind of twist it. I don't know if this mannequin will let me get it all the way there. Okay, almost there. So this is about as far as the mannequin's going to let me go, but make sure that you do get it up to the marking in a real life situation. Okay, so now we want to make sure that it's in the right spot. So we're going to take the syringe. And we're going to go ahead and aspirate some, hopefully, stomach fluid. We're going to check the contents for color and texture and so forth. We can assume that it looks like normal good stomach fluid. Then we're going to take this, use our pH test strip over the basin, and we can assume the pH is fine. Alrighty, so now we can go ahead and hook them up to our suction. Right? And before testing that pH strip, I would have made sure there was the tube was attached to the, like on the nose for the strip while testing that. But now we can go ahead and secure it. So you need about a 2 to 4 inch piece of tape. You can go ahead and tear it like that so it can wrap around the tube.
Because you can roll.
Oh, and you do put a little bit of a skin barrier before you do that as well. Don't just put it on like that. Make sure the nose is protected. Alright, and then you can turn on suction. And once that's going, you can make sure that the patient is laying back to their original position, rail is back up. Perform oral care for them if you need to every 2 to 4 hours. And you can take off your PPE at this time as well. Alright, so moving forward, we're gonna take out the tube now. So we're gonna go ahead and put on our PPE. Identify the patient again. Explain what you're doing while you're taking their NG tube out. Make sure the curtain is drawn, the door is closed. Let them know any discomforts they might be experiencing. And do you perform hand hygiene before you do this? Alright, so they're back in this position, and we're going to go ahead and turn off suction to start. So we'll turn that off. And then also in the previous video, I'll just say now, we do want to go ahead and clamp this. We would have wanted to attach it to their shirt. I'll just show now. Make sure they look from side to side like that, so you're not going to like have the tube come out of their face or anything. And then you'd hook this onto their shirt. But I'm just going to go ahead and take it out now. Just forgot to mention that in the previous. Alright. But suction's turned off. And we can go ahead and take this out and make sure you clamp. Because we're going to want to flush with some saline. And again, make sure all these things are still out like we did in the previous video. I just left it because it's already there. But make sure the setup looks like this. And then we're going to go ahead and take from the saline over here about 10 mils. And we're going to flush it through. Alright. And now that that's done, we can go ahead and take off everything.
Just texted an emergency.
Well, we will assume that this tape came off. It's a little tricky. But essentially, you're going to take the tube and coil it. And you're going to ask the patient not to breathe during this. And you're going to want to be as quick as you can. So yes, sir, please don't breathe. And then quickly pull this. Alright. And then you'll go ahead and dispose of this. Like such. Alright, and then just essentially make sure that your patient is comfortable again. You can remove your PPE, perform hand hygiene, put them back in the position that they initially were, and that's how you remove it.